I just wanted to capture a couple of things with Carolyn, and because of polio, this foot is very flexible at the forefoot and quite weak in the toes and quite weak in the plantar flexors, and that's a tremendous amount of mobility. I think you can see that, whereas if I attempt to do the same thing over here, there's a little bit of give, but not much. And so that does feed into her gait pattern. We actually mobilized both tali and took it from 0 degrees dorsiflexion to greater than 5 degrees. The left hip lacks extension, and therefore it remains in flexion, which is easy for me to see, but I sincerely don't believe you're going to see that on film. But if I were to put the camera down low and just shoot across here, you would see that this is more prominent. This femur is more prominent. And if I go under the knee in the popliteal space, I immediately hit soft tissue. On this side, I can go underneath it and not encounter soft tissue because this knee is flexed. So that's an exaggeration. So hopefully, if we gain extension in this hip, then maybe that knee will then straighten out. Remains to be seen, but we'll try. Limitation of hip extension on both sides, actually. She only has 5 degrees on the left side. And on the right side, she has 5 degrees. And she goes to neutral on the left side. Pelvis is extremely rigid. I just can't get any give through this structure. It feels like I'm pushing a bowl of concrete that's set. If I try and glide the pelvis over to the left, there's just no yield with a reasonable amount of force. Difficult to see in the front. Looking at the pelvis in the front, things kind of look rather even. Maybe this is a little bit higher. Let's have you lie on your stomach, please. And I didn't speak a lot when we were watching her walk, but she certainly does demonstrate rigidity throughout the pelvis when she walks. And what I found, and I have a set of big calipers that I could bring in and put numbers to this, but this is soft tissue here, and then I land on the ilium at a place I call the posterior iliac shelf, which is smack in the middle on one side. It's kind of a flat part of the ilium, and you can see on the other side there's a distinct difference. So at a glance, it's not subtle. And I would say that the difference in height is approaching an inch. It's a 3/4 inch or more. And if we then look down at the ischial tuberosities, per visual inspection, they seem rather symmetrical. I can't really call it, but I would say that developmentally, in the posterior portion, the right hemipelvis is taller than on the left. And when she's lying on her back, possibly the front is taller on the left side. But hard to measure. What we need to do is put that all together and put it in a meaningful context. And given that she wears a heel lift, and given that she has some hip pain and difficulty with gait, part of that chronic from polio at age 15 months, it's something that we'll have to put together. And it was interesting, when I see someone with a pelvis that rigid, I can't even push through that sacrum. I can't push through that ilium. I can't get superior glide, inferior glide mobility, and I've been doing this with measured forces for many decades. What I did find interesting is this ischium is posterior, and that's a flat portion of the ischium. I'm sure the camera you won't be able to see it through the camera, but this is posterior on this side, and it has no give, which I would predict. What really surprised me is she actually gives on this side. I can actually take up the slack through this structure until an end point, and then I can add additional force, and it translates all the way down to the heel. I see the foot moving. So noteworthy, interesting. I'm not going to interpret that. We're going to interpret it through a process of intervention. And maybe in the standing film you saw the kyphosis, which is the way that she's made. I can actually get some mobility through this spine. I would call it rigid, somewhat rigid, but I can take up the slack throughout and then add a little bit of spring mobility, force transmission through the thoracic spine. However, when I jump over onto the ribs, different story. with a reasonable amount of force, I can't induce any motion there. I don't feel like I'm taking up the slack in anything except, skin and muscle and such. But no yield there throughout, and it's that way on both sides. I just little tiny bit of give over here below the scapula, but in between the scapula, no yield at all in that portion of the rib cage. I'll check her rib cage anteriorly, and she is also quite rigid at the occipital joint, but I think we'll stop filming here before I yammer on too much.